Welcome to aminacademy.com. In human anatomy and physiology regarding the cardiovascular system, let us discuss about blood vessel pathology. Pathological changes. Atheromatous plaques are patchy changes that develop in the tunica intima of large and medium-sized arteries. Initial changes show a fatty streak in the artery walls. Mature plaques consist of accumulation of cholesterol and other liquids, excess smooth muscles and fat-filled monocytes form cells. The plaque is covered with a rough fibrous cape. As plaques grow and thicken, they spread along the artery wall and protrude into the lumen, eventually in the whole thickness of the wall and a long section of the vessel may be affected. Plaques may rupture, exposing subintimal materials to the blood. This may cause thrombosis and vasospasm and will compromise blood flow. Arteries most commonly involved are those in the heart, brain, kidneys, small intestine, and lower limbs. Causes of atheroma. The origin of atheromatous plaques is uncertain. Fatty streaks present in artery walls of infants are usually absorbed, but their incomplete absorption may be the origin of atheromous plaques in later life. The incidence of atheroma is widespread in developing countries. Why atheromatous plaques develop is not clearly understood, but the predisposing factors appear to exert their effects over a long period. Effects of complication of atheroma, thrombosis and infarction. If the fibrous cape overlying a plaque breaking down, platelets are activated by the damaged cells and an intravascular blood clot forms, that is a thrombosis, blocking the artery and causing ischemia and infarction. Emboli may be break off, travel in the bloodstream and lodge in a small arteries distal to the clot, causing small infarcts. Now we'll discuss little about further about blood vessels pathology. Blood vessels pathology encompasses disease and conditions affecting blood vessels, including arteries, veins, and capillaries. These conditions can range from narrowing of the arteries, that is atherosclerosis, to weakening the bulging of vessel walls, that is aneurysms, and inflammation of the vessel walls, that is vasculitis. Atherosclerosis, a buildup of plaque, fat and what is a plaque? Fat and cholesterol deposits inside arteries, leading to narrowing and potentially blocking blood flow. This can cause conditions like coronary artery diseases affecting the heart and peripheral artery diseases affecting arteries in the legs and feet. Next, peripheral vascular diseases, PVD. What is that? Problems with the arteries outside the heart and brain, often caused by atherosclerosis. It can lead to reduced blood flow to limbs, potentially causing pain, ulcers, and even gangrene. Aneurysms, a bulge of weakening in the wall of blood vessels, often affecting large arteries like the aorta. If the aneurysm ruptures, it can lead to severe bleeding. Vasculitis. What is that? Inflammation of the blood vessels which can damage the vessel walls and affect blood flow. Different types of vasculitis exist with each with varying causes and effects. Next one, Raynaud's phenomenon. A disorder that causes blood vessels to narrow in response to cold or stress, leading to reduced blood flow to fingers and toes, which may turn white or blue. Venous diseases. Problems with veins such as varicose veins, swollen, twisted veins near the skin surface, and deep vein thrombosis, blood clots in the veins. What is the thrombosis? The formation of blood clot within your blood vessels which can obstruct blood flow. Other vascular diseases include conditions like stroke caused by reduced blood flow to the brain and hypertension, high blood pressure, which can damage blood vessels over time. Next one, pathophysiology. What is that? Atherosclerosis involves endo, endothelial damage, smooth muscles, cell proliferation, and the accumulation of lipids and macrophages within the artery wall, forming plaques. Aneurysms can be caused by weakening of the vessel wall due to congenital conditions, trauma, infections, or underlying diseases. Vasculitis. What is that? Vasculitis can be triggered by immune system responses, infections, or other factors leading to inflammation and damage of the vessel walls. Thrombosis occurs when blood clots form due to combination of factors including blood flow disturbances, vessel wall injury, and changes in blood coagulation. What is the treatment for that? The treatment for blood vessels diseases depends on the specific condition and its severity. It may include medications to manage blood pressure, cholesterol, or blood clotting, lifestyle changes, for example, diet, exercises, surgical procedures, example, angioplasty, bypass surgery, or other therapies. So far, we discussed little about blood vessels pathology. We have done. Please subscribe our YouTube channel.